Thank you very much, Jenny. I'm hoping that this is working. So I've got the screen up. Thanks very much, Jenny, for this nice introduction. I am delighted to talk to you a little bit about vaccinating beef and dairy cattle this evening. And hopefully you'll walk away in half an hour with some things that you may be able to improve with regards to vaccinating your dairy and beef cows. But before I start with my top 10 tips that I put together for this presentation, I would like to refer to the ONeill report that was only published recently, in May actually. And that was a report that was put together in request to the government by Lord Jim O'Neill, who's an economist and who looked into antimicrobial resistance. And he said a few things relating to vaccination that I think are very relevant for this presentation as well. So what he mentioned was that vaccines are considered among the most cost-effective ways to prevent morbidity and mortality in infectious diseases, and also that vaccines against infectious diseases have had a huge impact on human health in the past 50 years by controlling and sometimes eradicating diseases such as smallpox, diphtheria and tetanus. In addition to that, he also mentioned some of the advantages of vaccines compared to antibiotics, for example, and he said that vaccines don't suffer from resistance in the same way that antibiotics often do. So, although vaccines will sometimes need to be improved because the virus gets a little bit smarter every year, and that's what we see, for example, in human influenza vaccines, there is no resistance, and even that slight change of viruses within our cattle pathogens that we vaccinate against are actually very minimal. And then the last thing that he mentioned in his report was perhaps maybe the most relevant for this evening, and he said that vaccines already play an important role in preventing disease in farm animals, but they're actually likely to have even a greater role going forward as the pressure increases to optimize antibiotic use. And that also leads to my second slide, which is where the media is quite concerned about, and that's antibiotic use in farm animals, which threatens human health, is what some people would say or would believe. And I think we could have an evening discussion about who the real threat is to human health, if it's actually other humans or if it's cattle, but I don't think that's the focus for this evening, so I'm not going to focus on that. But I think what we do need to realise that if we optimise the use of our vaccination strategies on farms, that will likely lead to a reduced use of antimicrobials, and that is really something that we have to focus on as a farm animal industry, because I think if we don't do that proactively, then someone will probably get a stick and make us do it somehow. And I think if you look at the antibiotic use or restrictive use that has been going on in the Netherlands recently, which has been perhaps quite threatening for the veterinary profession, I think it is quite important for us here in the UK to take quite a good proactive approach. And the picture that you see on the right-hand side, which says we need to use existing antimicrobials better, also comes out of that ONeill review. And I just put it in there because I do want to sort of balance the responsibility, I guess, that the human healthcare has compared to the farm animal industry healthcare. Because one of the things that was highlighted in the report is that there was a study done where they've shown that half of the children and newborns in the study sample that they looked at were treated with a suboptimal dose of a commonly used antifungal. Now, I'm going to give you some examples of suboptimal use of vaccines in the farm animal industry, but I would like to, I guess, reiterate that these things happen in the human healthcare world as well. So I think it's a responsibility where all of us can aim to improve. So what we did with regards to some research that I've used for this presentation and for which I would like to present some of the results is we asked farmers what they vaccinate against and why they vaccinate against certain things and how they vaccinate. And that led me to, I guess, these top 10 tips that I would like to discuss this evening. Because if you look at all the vaccines that are available to vaccinate the dairy cattle against, there's a whole range of them, right? So that's what you see on the left-hand side in that green box. There's a whole range of vaccines against respiratory diseases, against clostridial diseases like all our co-vaccines and those vaccines, and against a variety of reproductive diseases. And trying to pick the right diseases to vaccinate your cattle against is quite important. And if we look at our farmers in the UK, and again, this is not a huge sample, it's around 200 beef and dairy farmers, and what we see is that the majority of dairy and beef farmers will vaccinate against IBR, against BVD, and the majority of our dairy farmers would vaccinate against lepto as well. But there's also other vaccines. If we look, for example, at the clostridial diseases or the respiratory diseases, where the uptake is not that great, right? Somewhere around 30 to 40%, for example, for our beef with respiratory diseases. And then if we compare that with what people find on post-mortem, so Ben Strugnell has done really good work where he's been looking at fallen stock and the causes of death for the fallen stock that has come in. And what you see is that pneumonia is still quite a common cause of death in beef animals. And I won't say that vaccinating those animals will solve all those problems, but they can definitely play an important part. So I'm not in this presentation going to go into detail on a particular vaccine, but I'm really going to focus on 10 aspects that I think will apply to the majority of vaccines that cattle farmers, dairy and beef farmers are using. So the first thing to consider is what you actually want to achieve by vaccinating your cattle. And what is interesting is that the majority of vets will look at vaccination as a preventive tool, so to prevent disease happening on the farm, while the majority of farmers will see vaccination as a tool to control disease on the farm. And both are correct, but both require a slightly different vaccination protocol. So if I'm talking about disease control, I'm thinking about less severe disease and less production losses after you've vaccinated your animals against IBR, for example. If I'm thinking about disease prevention, you actually try to avoid that disease happening on your farm. And if we take IBR again as an example, if that's what you want to achieve, you need to make sure that your animals have not met that virus before they are vaccinated. So if with IBR you, for example, start vaccinating them when they're at breeding age, you need to be fairly certain that when they're out grazing, perhaps as young stock, that they haven't been exposed to IBR before that. Because if they have been, when they've been out grazing, those animals will become latent carriers of that virus. So they will probably come over that infection and they will probably deal with the clinical disease side of things if their immune system works well, but they will become latent carriers of the vaccine, of the virus. And when they then come into the lactating dairy herd and are stressed at certain points in time, they will start shedding that virus again. Some people will also vaccinate because they want to try to eradicate disease from a herd, right? And we can think of the BVD-free program that's going to start pretty soon, which I think is a really good plan and a really good thing to get engaged in. But if you're thinking about eradicating disease, you really need to realize that vaccination is only a part of disease control, right? It's not a silver bullet. So I sometimes get a little bit worried if farmers say, oh, well, I vaccinate for everything because I vaccinate for IBR and lepto and anything out there. So I can go to the market and buy any cow that's out there with an unknown disease status because I've vaccinated all my cattle and they're all protected. Because I would argue that that is not always the case. Even though you've used your vaccine in the most optimal way, it is unlikely to give you 100% protection in every animal in your herd. And I'll explain a little bit later why that is the case. Number two is get your timings right. So when we did the study, we showed that only 46% of the respondents administered the second dose of the vaccine in a primary course within the recommended time frame. So that means if you vaccinate an animal for the first time in its life, it often needs a booster 4 to 6 weeks after its first injection. And that interval in between that first and second injection is different for different vaccines. But that comes quite specifically, that comes quite tightly. And it doesn't matter probably that much if you're a day or two out, but if you're going to be weeks out, that vaccine is not going to be able to protect your animal effectively. And that all has something to do with regards to that, what that vaccine actually tries to achieve. So after its first vaccination, it will start building up immunity. But that immunity needs to be boosted 4 to 6 weeks later to actually generate a good memory of the immune system, and that immune system needs that memory to be able to protect that cow when the virus or when bacteria from the field come in at a later stage. So that first course that the animals get, that those first 2 vaccines need to be given at the right time frame. And I well realize, particularly in dairy herds, but also in beef herds, that it's not always that straightforward to get this right. So I think to try to get that as good as possible, it is really important to draw up your annual vaccination plan well in advance. So if for you it's most easiest to vaccinate your cattle in the winter because then they're outside, or then you've got more labour available, or whatever the reason may be, it is worth sitting down with your vet somewhere in the autumn and make a plan for the next year with regards to your vaccination protocol, because that will give you the best chance to be able to implement it the best you can. Number 3 is do not vaccinate too early. So 14% of respondents vaccinated against respiratory and clostridial diseases earlier than the recommended age, right? So this is about our baby calves. So if we start vaccinating those calves too early, that vaccine actually won't work, because at the time of vaccination, that calf is likely to still have maternal antibodies that it got via the colostrum from the dam. And when those maternal antibodies are still present in the calf, that will neutralize the vaccine that you give to the calf, and therefore it becomes ineffective. Now, that balance between maternal antibodies and vaccination is very different from one vaccine to another. So again, you need to look at which specific vaccine you're using, and it will state on the data sheet what the youngest age is at which you can start using it. You can also imagine that the variability of that level of antibodies, maternal antibodies, will be quite example, if you vaccinate the dam just before she calves or in late gestation, she will have a couple of weeks before she calves to build up high levels of antibodies in the system, and they will also come into the colostrum and they will be taken up by the calf. So that calf will end up with high level of antibodies. However, if that dam has not been vaccinated against Clostridia or any other disease and hasn't been exposed to that virus as a field virus, then the dam will not have any maternal antibodies, so she won't have anything to put into the colostrum, and therefore the calf won't have any antibodies, won't be able to receive any maternal antibodies either. So quite a bit of variability with regards to what the dam has been exposed to, but the key message here is to make sure that you're not vaccinating your animals too early. It won't have a bad side effect on your young stock. It's not that they will get more disease when you give them the vaccine, but it is more of a waste of money and you're vaccinating them too early. Consider the animal's health and pregnancy status. So again, from that same study, it showed that only 34% of respondents excluded certain animals from vaccination, 23% of which mentioned to exclude sick and injured animals. And the key message here to take away is that sick animals are not likely to respond effectively to a vaccine. If you think about how a vaccine works, it is quite different from an antimicrobial, right? If you give a cow an antibiotic, it will kill the bacteria that are in that cow, and that will make that cow better. If I vaccinate a cow, I vaccinate her with the actual pathogen, but in an inactivated form, so it won't make that cow ill. But what it will do is it will trigger the immune system of that cow to start building a good immune response, and she can use that immune response when she's going to get presented with that same virus, but then in the field form in the future. So that's how a vaccine works. If you then think about sick animals that are immunocompromised, you can understand that they will not be able to build that immune response when you vaccinate them. So it's not likely to make them more ill. That's very unlikely to happen with the vaccines that we currently have, but it is likely not to be very effective because the immune system of that cow is not working appropriately. Now, what we also need to keep in the back of our mind is that we're using vaccines very much as a population or at a herd level. So if you think that you've got a herd with 100 cows and one of them is ill and there's 99 that you do vaccinate appropriately, then those 99 cows that are vaccinated appropriately will help to bring down the infection pressure that you've got in the herd, right? So that's going to make it more likely that that one cow that is not protected effectively with the vaccine, it's going to make it less likely that that cow will get ill because there's just less virus around because of all her herd mates that are vaccinated appropriately, and that will bring down the infection pressure. With regard to the pregnancy status, you need to be a little bit careful because we've got some vaccines that we're not allowed to use in cattle when they are pregnant because there's a chance of abortion. But there's actually also other vaccines that in particular we want to use in late pregnancy, because what we're trying to do is we're trying to generate those maternal antibodies that we can then put in the colostrum, or that the cow then puts in the colostrum, and that the calf then gets when she drinks enough colostrum. Right, so this is particularly for our vaccines against calf scours, and you can imagine so Rota, Corona, E. coli, but also for our clostridial vaccines, where the key message is that we want to get those calves and the young stock protected. It is important that we try to get those antibody levels as high as possible in the dam when she's relatively late in gestation, because that's going to then give high levels in our colostrum. So that's a way that you can optimize the protection that you can get out of a vaccine. Number 5 is read the data sheet. So about a quarter, almost a quarter, did what they've done previously and didn't need instructions. So that. But you have to be really, really careful, because those data sheets change, the dose rates change, the storage requirements change, and that is not always visible on the outside. So it is always worth asking your vet when you pick up the vaccine if anything has changed, or consult the data sheet, have a look at the data sheet that's in the box, or look at the VMD product database that's available online for everywhere, so for everyone. So that's from the Veterinary Medicines Directorate. That is quite a useful resource as well. Use the correct route and use the correct site. So 77% of respondents were using the correct route, so they were putting it in the muscle when it needed to go in the muscle, they were putting it under the skin when it needed to go under the skin. And then 69% of them were injecting at the recommended site on the animal. So that relates to vaccinating in the neck if the neck is the recommended site. Now, so the majority of the people get this right. For the people that get it wrong, does it really matter? Does it really matter if I put a vaccine under the skin or if I put it in the muscle? And to be honest, we actually don't really have a lot of information on that. So it may make a difference, it may not make a difference. Using intramuscular vaccines intranasally, yes, that definitely does make a difference. But for some of the intramuscular subcutaneous things, we don't really know. However, the product is registered for one purpose, so I would definitely advise to use it for that purpose, because in that situation it has been proven to be efficacious. With regard to the recommended site, you can sort of have the same discussion, right? Does it matter if I inject it in the bum, if I can inject it in, if that's easier to do than injecting in the neck? And if it goes in the muscle, it probably doesn't matter that much. Again, there's not a lot of data available out there, and it would be really useful to get some more data on that. However, if you think about it a little bit logically, it probably doesn't matter that much with regards to efficacy. However, if you think of injection site lesions, it does make a big difference. So that's why I put those pictures of injection site lesions at the bottom of this slide, with those not that appetizing purulent masses in muscle, because we know that around 4 to 6% of our carcasses, cattle carcasses, do have injection site lesions, and knowing that our lesions in the neck will be less of a cost to the farmer compared to having lesions in the rump, where the more valuable pieces of meat are, it does make using the recommended site of the animal actually quite relevant and quite important. In addition to that, and that's particularly for dairy cows, we also know that if we vaccinate in the neck, there is very few underlying structures that we can do damage to if we get it in the correct site. If we inject those cows in the gluteal muscles, particularly the dorsal gluteal muscles on the rump, it is quite likely that we will be able to hit the sciatic nerve, which is fairly superficial in our dairy cows. And then one of the perhaps key ones here is ensuring correct storage. And this is not work actually that's done by us, but this is the work that's done by MSD and Paul Williams and his team. And what they did is they looked at fridges, on-farm fridges, and they put maximum thermometers in there for an 8-month period, and they tried to check, or they checked, whether those fridges stayed within the 2 to 8 degrees Celsius boundaries. And maybe surprisingly, none of those fridges were staying within that limit. And that is perhaps disappointing if you think that you've just spent a couple of hundred or sometimes even thousands of pounds on vaccines. If you then put them somewhere in a place which renders them useless after 24 hours, that is really not what we want to achieve. With our vaccines. So what I would really recommend for the people that haven't got it yet is put one of those maximum thermometers in your fridge. They're only 10-15 quid and you can buy them online quite easily. And it will really give you good information if your fridge is actually an adequate place to store your vaccines. Also important not to freeze your vaccines, particularly killed vaccines are quite sensitive to freezing. So they shouldn't be too hot, they shouldn't be too cold. They're quite difficult to deal with perhaps in that respect, but a fridge in general will do fine. In addition to that, I would also say if you're vaccinating a large group of cattle and you're going to be busy all morning or all afternoon or perhaps even all day, carry those vaccines in a cool box with ice packs when you're vaccinating to try to keep them in that 2 to 8 degree boundary. I should make one comment there because not all vaccines have that as their recommended ideal temperature. So the majority will have, but there's 1 or 2 that you can keep at room temperature, and that's dependent on how that vaccine has been developed. But correct storage is really a key thing to focus on. And then we're moving on to number 8. So number 8 is about hygiene and cleanliness. And for example, if you're using repeater guns, which is quite commonly used when we're vaccinating lots of animals, it is crucial to clean those repeater guns properly in between use. And I can go into a fair bit of detail there because yes, you need to use disinfectant, but you shouldn't use disinfectant in the area where the actual vaccine comes because that might make that inactivate that vaccine. So you need to be quite specific about cleaning. In addition, you need to be quite specific about needle size and needle length and all those type of things. And because we haven't really got time for that now, I would really recommend you to watch the video on vaccinating cattle safely and effectively, which you can find on the Dairy Co. on the AHDB Dairy website. And it has a 17-minute video in there which takes you through all these different aspects of things that are important when you're vaccinating cattle, which is, I'd like to think, really worth a look. What I would say or like to comment on is with regards to changing needles. So people would often ask, well, do I need to change needles in between every cow? And my opinion would be, yes, theoretically you should, because it's good veterinary practice, and there is the possibility of transmitting diseases by using the same needle in multiple cows. However, I think you also need to be a little bit practical about it. And I think what is important when we're vaccinating cattle is that we try to do it as quickly and as stress-free as possible for the animals that we're vaccinating. So if we can reduce the time that we need to keep animals restrained, then that is beneficial as well. So if I think about vaccinating a group of animals and those animals have been housed together for a longer period of time, then I would argue that you could use a same needle for multiple animals within that group. Because if we think about diseases that we can transmit via a needle, those diseases will very likely already be present within all the cows in that group already. So I do think you need to sometimes make some perhaps practical decisions to make it doable, I think, in practice. I put that picture in the left bottom though, and this is the tip of a needle from a hypodermic needle that diabetes patients use. And what you see is after that needle has been used 6 times, it becomes quite blunt and it becomes quite rough as well, right? So if we're thinking about using needles multiple times, you can sort of imagine that if this would happen to a needle that we use to inject cows, that will probably be less comfortable for the cow. It will also be perhaps less comfortable for us because we need to push harder to get the needle through the skin. And you can see that on those rough edges, it's probably more likely or easier for dirt and bacteria to get stuck in there and therefore cause injection site lesions. Right? So that would be a reason to use as many new needles or clean needles as possible. Right? I really don't want people to use the argument of money for a box of needles when as a reason not to change needles, because I think once you've spent the money on the vaccine, buying a box of 100 needles is really not a big investment. So that I don't think that that's a good reason not to change needles between animals. And otherwise, with regards to hygiene and cleanliness, I think the sort of thing that I tend to ask farmers is I'd say, well, what you want a nurse or a GP to inject you with the equipment that you're actually using. And I think that sort of tells you a little bit if you need to improve practices or not. And I've seen farmers use brilliant, nicely clean equipment that's actually better than perhaps the average hospital that I've seen. So it's definitely possible, and it's well worth thinking about. Right, number 9, educating staff. So when we asked farmers in our questionnaire who administered the vaccine was most commonly administered by farm workers, sometimes by senior staff, and only very sometimes by vets. So that means that a lot of times we've got possibly inexperienced people vaccinating, right? Now, I will definitely not say that it can only be vets who vaccinate cattle. I think anyone who is competent and confident in dealing with cattle and restraining cattle and handling cattle can learn how to vaccinate fairly quickly. That is not a difficult skill to learn once you know how to deal with cattle. And again, I would really encourage everyone to look at that video, of which I've got the link here as well. And in addition to the video, that takes about 17 minutes to look at. There's also a little quiz that asks you 10 questions around the video and gives you some feedback just to sort of make sure that you get the key messages with regard to the things that are important when vaccinating cattle. In addition to that, so in addition to training the staff or anyone that helps you on the farm, I think it's also key that farmers share knowledge and that farmers help each other try to implement that best practice. And having worked in various places around the world, I'm always amazed to see how many different things are, like how many different repeater guns are being used across the world. And some work really well, some don't work at all, some are really easy to clean, some are impossible to clean. All that sort of practicalities are really nice to share in discussion groups, I think, or to share with your neighbour and try to help each other improve our practice and therefore also improve the welfare and productivity of our cattle. And that gets me to the last one, so my tip number 10, and that's all about the vet, so inform your vet. And that tip comes from a slightly different bit of research that we've done. So what we asked 13 experienced dairy practitioners to advise us on the best vaccination protocol, or on the vaccination protocol that they would advise to a simulated farm. So we gave them a farm scenario and said, okay, given the information that you've got on this farm, what would your vaccination advice be? And the interesting thing was that those vets needed to ask us 26 additional questions before they could confidently make a recommendation for that particular farm, which is interesting because that shows how much information the vet needs to make the best risk assessment to come up with a good bit of advice for you on your farm and to actually tailor that vaccination protocol to your farm, right? And those things don't only depend on if you've got beef cattle or dairy cattle, but they depend on what your calving pattern is like, what other diseases you've got on the farm, but also some personal goals. What are you trying to achieve with your herd? Are you exporting any animals? What is the goal? Where do you want to get to in the long term? Are you willing to take risks, or are you quite risk averse? All those type of things are important for a vet to know, to give you their best advice with regards to what the best vaccination protocol would be on your farm. So in that respect, it's also important to be aware of vaccine preventable diseases on your farm. And sometimes these diseases might be obvious, but there is quite a few endemic diseases that we have in the UK that are not that obvious, right? They just influence fertility a little bit. They immunocompromise animals a little bit, like what BVD does, for example. And you can't really put your finger on it, but actually knowing that those diseases are around and which of those diseases are around can help you and your vet build a plan on which vaccines are the best to work on, or which other measures would be more valuable to put in place. In addition to that, collecting data to help the vet with the decision making, right? So knowing how much pneumonia cases you've got, knowing how much calf scour cases you've got, knowing what your fertility performance in your cows is, knowing how many abortions you've had, how many empty cows, those type of things. That's going to make it very useful for that vet to make that risk assessment, so he or she can advise you appropriately on which vaccines are worth spending the money on, and perhaps which vaccines you might leave at a later stage, and where perhaps some changes in management will help you deal with those as well. And then my last line here is more focused at vets than at farmers, actually, because I know that there's often quite a couple of vets listening into these webinars as well. And I would really encourage vets to be proactive and to instigate a discussion about vaccination with their beef and their dairy clients. And I say this because a lot of the research that we've done shows that people are sort of waiting for each other. So if we talk to farmers about vaccination, they say, well, actually, my vet doesn't talk about it. So if he or she doesn't talk about it, that probably means that it's not important. So it's a non-item. So I'm not vaccinating, because if I would, or I would have to, my vet would tell me to. Well, if I then go and talk to the vet, they will sometimes tell me that they say, well, actually, my farmer doesn't talk about any of the diseases that I can vaccinate against. He never asks me about vaccination. That probably means that he doesn't want to spend the money on it, even though I might think it's actually quite a useful thing to do. So that sort of means that these two groups of people, that farmers and vets, sometimes appear to be waiting on each other a little bit to start the discussion. And knowing that vets know a lot about vaccination and about preventing and controlling disease on the farm, I think it's really the vet's role to initiate that discussion with their clients on the farm. Because I think if you look at the endemic diseases that we've got in this country, I think if we proactively actually discuss how we can deal with this the best, as we're trying now with the BVD-free plan, I think we definitely have a chance to get better control of some of these diseases. So to summarize those top 10 tips, right? Talk to your vet, have a goal, have a vaccination plan, be aware of the disease status on your farm, read the data sheet, make sure that you use the correct storage needed for the vaccine you're using, choose the correct site to inject, choose the correct route to inject, make sure you get the correct timing, so not too early and at the right interval. Consider the status of animals, so know that we appreciate that they might be ill, or that they might be pregnant, or maybe they need to be in late gestation. Think about hygiene and cleanliness. And think about educating the staff that will be vaccinating your animals, because the vaccine can be brilliant, but we need to make sure that it gets into the right animal in the right way, and education there is key, I think. So those were my 10 tips that I wanted to present to you this evening. And I would like to thank a lot of people that contributed to some of the data that I've just presented, but I would specifically like to say thank you to Imogen Richens, Miney Brennan, Liz Cresswell and Jordan Smith. But also would like to thank AHDB Dairy, the Centre for Evidence-Based Veterinary Medicine, and the School of Veterinary Medicine and Science for funding some of the research that we've done. And I've put my contact details there in case people want to contact me or ask a question. And I've also put the Twitter address there of our clinical research group at Herd Health, and that's the address that we use to publish a lot of to sort of promote the research that we do, or to promote research that other groups do that we think is relevant to dairy and beef farmers out there.